first virtual conference. I, Shakeel Akhter at Indus Hospital, welcome you on board. I'm honored to be your host for today for this IT session. Ladies and gentlemen, it was April 1996 when I had the first interaction with any healthcare institution as an IT professional. According to my knowledge, at that era, hardly any healthcare institution were actually considering digitizing their health record or anything like that. I'm sure you will agree. According to my knowledge, at that era, hardly any what echo has Sorry. ये मेरा ख्याल है यहाँ से सर पे लैपटॉप पे लॉगिन मैं लॉगिन यहाँ से नहीं Start again?
Yes. Yes, start.
ठीक है. Good, from the beginning?
Yes.
Okay. Assalamu alaikum and very good morning, ladies and gentlemen. On behalf of Indus Hospital, 6th Icon, and most importantly, the first virtual conference, I, Shakeel Akhter, CIO at this hospital, welcome you on board. I'm honored to be your host today for this IT session. Ladies and gentlemen, it was April 1996 when I had the first interaction with any healthcare institution as an IT professional. According to my knowledge, at that era, hardly any healthcare institution were actually considering to digitize the medical record or anything like that. I'm sure you will agree, most of the institutions were actually working to computerize their administrative areas like patient billing or HR, inventory or financial accounting, something like that, but not the medical record. And that was pretty. In the beginning of 2000, a healthcare institution actually start thinking seriously about that. And in the last decade, we all witnessed tremendous amount of work done by both the IT professional and the healthcare institutions. And they did a very good job, in fact. And they start digitizing the medical record and other processes. And in the last 2 years, thanks to the COVID, actually, rapid growth was seen, and we did some serious work to change this mindset. And then probably the patient is also realizing the importance of digitizing the computer medical record. Our renowned guest speakers today they are genuinely involved and did some serious work to change this mindset and remain throughout this journey from zero medical record to a complete digitization of healthcare industry with great practical experience. Without wasting your time, let me take this honor to connect you to our first guest speaker who really does not need any introduction, Dr. Zakiuddin Ahmed, who is the CEO of Digital Care and Project Director of RIHS. Dr. Zaki is the legend of his own kind. He's the pioneer of telemedicine in Pakistan and has many Pakistan's first credit in his digital healthcare space. He has remained a focal person on e-health for WHO and MOH. He is the professor of digital health at Health Services Academy, project consultant for digital health at King's South University, and CEO of Digital Healthcare. His other areas of expertise including the patient safety, health research, and healthcare leadership. So here we go, a legend, a mentor, and a very good friend, Dr. Zakiuddin. Please. Dr. Zaki.
Hello? Can you hear me?
Dr. Zakir, can you hear us?
I can hear you.
Okay, we
Yes,
can
I
hear
can
you
hear
too.
you.
Yeah, we can hear you
Okay.
too.
Can you
Please, आप अपनी can you just start, please?
please confirm if you can see my presentation?
We cannot see your presentation right now. Okay, we can. We can.
Okay, great. Thank you very much. Bismillahirrahmanirrahim. Assalamu alaikum, everyone. Thank you, Shakeel Saab, for inviting me at this hybrid conference of Indus Hospital. It's always a pleasure and an honor. As Shakeel Saab mentioned, I've been working in digital health for a fairly long time now. We used to call it telemedicine many years ago, more than 2 decades back, but now we call it digital health. So I'm going to just give you a quick rundown on digital health. We call it the Digital Health 101, a very quick, very brief, just to set the stage for other speakers who I'm sure are going to add more value in this conversation we are going to have today. So let me begin. This is my introduction. I work in these four areas essentially: digital health, patient safety and quality healthcare, health research, and healthcare leadership. And I work as an entrepreneur, have an experience of more than 2 decades in this space. Just to give you a rundown of the healthcare ecosystem. So many years back. Uh, and if you look at, the next few slides are going to give you an idea of how the technology companies are contributing in the healthcare ecosystem and the digital health journey. So this is a slide where I kind of give you a very short overview of how technology has historically helped, same way as we know technology. But Edward Jenner developed a smallpox vaccine to prevent the unpreventable. Just technology allows you to do things which you cannot conceive even, or which we think are impossible. William developed the X-ray, allowing us to see the invisible. Alexander developed the first antibiotic to cure the incurable. And access to healthcare has been solved to a large extent, not entirely, but to a large extent due to technology. So technology has always played a very significant role in healthcare. A few slides to give you an overview of how we started, how healthcare has transformed. More than 100 years ago, it was more of a human touch. Physicians and neighborhood and get actual consultation. There are numerous models globally.
Good morning, Ms. Johnson. I'm Dr. Sharma. I'm an emergency room physician. And tell me what's going on with you.
I'm not feeling well at all. I'm feeling really crummy. I've got lots of congestion.
I'm going to examine you right now. Press right over here under your sinuses.
So today we can get this, alhamdulillah. I wanted to talk about this revolution of e-patients, as we call them, or the digital patients. And they've started to realize that technology can be used and should be used. So if you look at the number of mobile apps, maybe 5 years ago there were like 100,000. Today there are more than 300,000 apps. Obviously, not all are validated, not all are very, very helpful, but a significant majority of these apps are very helpful, and they are validated. So even babies actually which were delivered through this project, Alhamdulillah, with satisfied mothers. Last is a little bit about the smart hospitals, because my personal wish is that Indus Hospital takes lead in this as well, inshallah, under the leadership of people like Dr. Bari and Shakeel and Dr. Zafar and others, inshallah, and obviously we will help and support them in this journey.
All right. Dr. Zaki, thank you very much. I really appreciate it. It's always a pleasure to have you on board. And in fact, it's always uh, having a lot of learning from your side. In fact, I never had a detailed understanding of past and the future all together at one presentation. I'm sure Allah Ta'ala आपको जज़ाए खैर दे. And definitely we'll having you again. But at this time, we were having a lot of technical difficulties from the internet side, and the voice was not very clear to us. Anyway, thank you very much, and thank you very much. Okay. I remember, and I'm sure those who witnessed the television shows in 80s, they must remember a show where there was some kind of a technology they were showing. The one person is moving from one planet to another planet just in a laser beam or something like that. And they were talking, just putting their hands on the air or something like that. At that era, in fact, including myself, was we were all laughing actually, and we were thinking that how is it possible? It's some kind of a movie gimmick or something like that, or maybe they are just fooling us, or something like that. Probably they were fooling us. But today, we all are witnessing that this mobile phone thing is already there, and people are talking, and our new mates are playing with their mobile phone, and the mummies actually are busy in their Facebook, and probably they are teaching some kind of yoga classes or something like that, and probably some kitchen stuff or something. So that's the reality. We were actually thinking about that this not going to happen, but today we have seen that that is all practical. So the same way nowadays, our healthcare professionals and technologists are seriously talking about future technologies. Like we are talking about the virtual realities, we are talking about the IoT at healthcare, and we are talking about the artificial intelligence and big data and many more things. In fact, some of us are still not taking them seriously. Our next guest speaker is basically who has 30 years of experience in the field of artificial intelligence, data warehousing, business intelligence, and GIS. Mr. Mansour Ahmed was the director at Tensor Mind Private Limited, a company which is specializing in artificial intelligence and deep learning in big data and developing products and solution for healthcare industry. So, ladies and gentlemen, let me put you through to Mr. Mansour Ahmed, a friend of Indus IT and the guru of artificial intelligence. So, please.
People predict by 2030 this will be around $16 trillion. So it's a huge amount, and that's
आपने
because
मेरा
of
कट कर दिया.
and the technology.
कट कर
And
देना.
definitely the AI will be the key player in that area. So what is about artificial intelligence? So it's about like people, it's like the term AI was coined half a century back. And of course, since then, the technology in terms of the hardware and the software were not fully equipped to have the full feature or full benefit of the technology itself. But it took time. Now, like 2015 and 16, it's all started and again, the hardware, the infrastructure got robust and powerful enough to handle the complex algorithm. So that was the era. Actually, the AI started back again. So when I was like working 30 years back, it was I was doing AI, but I was doing on a very compromised machine and the software and of course the hardware at that time. Now, when you say AI, I mean there's are two words: artificial intelligence. So something which is not natural, it is unnatural, man-made. That's okay for sure. But what are the other mean names for the alternative names for the AI would be because in today's era, if you see, we understand AI differently. It's not only artificial a term we use, but we talk about the augmented intelligence, something we call it neural network or expert system, or something. Sometimes we call it machine learning and deep learning. So these are the different names for AI we talk about. Of course, deep learning and machine learning is a way and a method to approach AI as a solution. So if I go to the next slide before going that, so one single line definition would be that AI is to augment human skills. So in terms of practical application, when we go to the corporates or the business or to the public sector over there, so wherever the human skills are there, wherever the human beings are renting their services, so AI can complement over there with its power and its accuracy and quality. Let's go to the next slide. So it says, why is artificial intelligence important? Of course, we need it for several things. We do have IT systems working in every corporate office, in every organization. If we go from hospitals to FMCGs to banks and insurance companies, but essentially, AI, when it comes, it is at the top, it's a layer above the conventional IT setup over there. So why we need it to automate things over there, repetitive tasks, for example, a call center solution, we can easily automate this thing. We can make it a robotics solution over there. So this job can be done easily by a robot or a software or algorithm over there. So it's like for the automation, so handling a high volume task, and then of course the reliability. Human has a tendency of a fatigue. So when it is handed over to the software, the algorithm, you actually overcome the fatigue factor over there. So machines are capable of doing a huge task simultaneously. That's one big advantage. And obviously the analysis at the deeper level, and then we adding intelligence to the products and services. When you talk about analysis at the deeper level, because there it comes the handling of the big data, which is not possible through to handle it through conventional IT system. You do need deep learning, machine learning kind of algorithms, powerful algorithms to process those information, which gives you new insights and new directions, which you cannot achieve through conventional IT solutions over there. And then, of course, the accuracy is the key part over there. And then, of course, we talk about the self-learning algorithm. So this is the real advantage when it comes to the AI solution, because these are the algorithms which learns from the pattern of the data, either it's your sales or stocks or the HR data, or it's coming through other sources from videos and audio. So it learns from the pattern and keeps improving itself. That's the biggest advantage of AI, and it's basically here to bring convenience to the life of the businesses and the people and the society and the mankind. And at the same time, it promises to cut down the costs and of course bring in the efficiencies over there, save time. And so that's all about AI, how it can help you in totality. But of course, we have to differentiate between the AI over there. So AI could be good, very good over there, but at the same time, it could be evil or notorious. All right. So basically, this is how if we train AI the good way, so it will behave good accordingly. And if it is like being trained in an evil sense, so it will behave that accordingly in that manner. So that's an important thing we have to consider how we want to use AI in reality. So it is like a child. So basically, we train a child, we teach them shares, we teach them good things about it, and accordingly, when they grow up, they behave like that. It's similar with the AI. But the point is that in the human life or training life cycle is a very lengthy one. It based a span on years, number of years over there. But with the AI, with the with the hardware that currently we have, we can minimize the timeline in days and hours perhaps, and then machine started behaving over there, right? Now, that is something which where we have to think about carefully. Importantly, how what data has to be trained. The key thing in the AI would be the key thing is the data. All right. So if your data is of a good quality, this is like a previous thought also in the IT, typical IT era. If you garbage in and garbage out, same applies here in AI. So algorithms and models would be simpler, but if data is garbage over there, if you don't have a good quality data, you always get the bad quality AI results over there. It's like anyone is similar to training a human being also. If you train him on a good on a bad thing, he will behave badly. So these are the key things that we have to consider in our mind while thinking of the AI application. As I said, like AI is certainly there to help businesses in the societies and the mankind to flourish and bring prosperity. Now, in terms of typical applications of AI, when you go to any organization, be it like a hospital, be it like any FMCG banks, as I said, so you'll always find data over there. But now you see in the right side there we have a new kind of data also coming in, which was previously thought to be not of a use in terms of analysis because there wasn't any like tools or algorithm which can process the video in a way that we wanted it today to identify people from the video, objects in the video, or a kind of identifying a scene or labeling it basically. What kind of scene is that? Or look people's attitude, or detecting anything which is related to safety and security of the people, maybe it's in images also at the same time, or if it is from the audio. So and now we need to convert the audio into text, for example, and we want to see the mood of the people in the audio they were talking. So these are the job tasks can be done only by specialized deep learning, machine learning algorithm leading to the artificial intelligence over there. So basically, in nutshell, if you see on the left side, you have your data which is actually coming from your conventional IT system, and the right side, which are the non-conventional sources of the data, combining together, entering into the machine learning environment over there, and giving you new insights from your conventional data also, and then of course another source of secondary source of the data, which we just saw on the right side over here. So now, moving forward, let me share with you four key milestones or achievement industry has achieved in the last 4 or 5 years. That has actually changed the face of the technology, and also in the sense that now people are more talking about AI. 5 6 years back, nobody was talking about AI. Very few people had this idea. But today, yes, of course, the talks are all around, and that's very important. So its application is from healthcare to space exploration to the mining, to the agriculture sector. If you go and if you go to within the organization, your HR process, your sales data analysis, your reach, for example, to the customer understanding, customer segmentation, and there are lots of application of AI. I mean, from a common man perspective to a business perspective. So every individual sitting at home, he or she is also experiencing AI through the smartphone application. Right now, we have lots of application working. Now, before we say that, so what are those four key milestones or key achievements the industry had like for the last 5 6 years? So one was the AlphaGo, which is basically is a Go game, which is a strategy game like the chess, but it's more complex than chess, which is by 19 by 19. So actually, the people thought that it will take another 12 15 years any algorithm beat any human champion, but it happened in 2017. The AlphaGo actually changed the entire concept, and it bring the biggest disruption in the market over there at that time. So that's one thing. So AlphaGo is something, a software algorithm deep learning, which is mastering in Go gaming, which is a top the toughest can say and the top level strategy game. That's one big achievement was AlphaGo from the DeepMind company. And second, again, coming from the DeepMind also, another milestone, which is just the news of this year, July last year to July 2021, when actually DeepMind announces the model of AlphaFold, which actually has unfolded the human body proteins up to 98.5% level, which was prior to that only in for many decades, like the human were only able to unfold it up to 17%, right? And this is one big achievement. This is the step towards the new drug discovery. And you talk about, for example, in the sense that the treatment also. So this will be a key player in the future, and especially considering the COVID scenario, and maybe like in the future, the other pandemic we expect, right? So this will be having a key role in this regard. So the next is the Google Quantum AI, right? Okay, this is the combination of things we need to understand. We are talking about the AI, we are talking about the quantum computing, and then we'll be talking about the another area where when it will combine, it will change the world face and will lead to towards the AGI, which is the artificial general intelligence scenario over there. Now, what is this Google Quantum AI has done? What we have achieved in October 2019, the algorithm was able and the quantum computer was able to process an equation which thought to be if a normal supercomputer is being standard supercomputer is being used, it will take 10,000 years. But that quantum computer with only 54 qubit has it done it in mere 200 seconds, and that's phenomenal achievement. So these are the two, at least the two, three things we have seen so far. And the fourth is of course the robotics area. Now we see that these are the animated images, by the way. I mean, you can find it on the internet. You talk about the autonomous, intelligent, and powerful robot, the Atlas, which was started like learning how to walk like 5, 6 years back, but today it can perform complex physiological movement autonomously and with all the power. So technically speaking, if you combine all this, the AI and the quantum computing and this mechanical power that we now have achieved, the marvel of that, and that is a full combination which is leading to a very powerful system over there, which has intelligence, which has the quantum computing power, which has the mechanical part of that. So this will actually be, when it is used in good faith, will be beneficial for the society and for the mankind. Like for example, if you're using it in the business, in the warehouses, the robots are there. We have seen robots for working in the automobile manufacturing sector for more than 30, 40 years now. But those were the dumb robots, right? But now we have intelligent robots, doing again lots of tasks, not only managing the warehouse over there, but rather handling, managing the tough mining tasks from the security and safety point of view, or in case of a calamity, helping the authorities to find out and to help and to recover people from any earthquake, God forbid, kind of situation over there. And then, of course, we have heard about a lot of the autonomous cars and all those things. So these are the things which now are not the any more science fiction, but we are seeing, and these are there. I don't call this Terminator kind of thing, but of course, we have to see and we have to like perceive the way the goodness for the of the man for the mankind should be like that. And of course, going forward in the healthcare, so lots has been done in the healthcare area, and one specialized in the application of AI is healthcare, undoubtedly. And in the healthcare, there are lots of application where it can come and help the healthcare people, whether be it the doctor, the radiologist, nursing staff, and the pharmaceutical, like we saw in case of AlphaFold. I mean, in terms of the fastest drug discovery. By the way, the AlphaFold is publicly available, and I do recommend for the researchers and the healthcare people, they can access this information, this data, this model, and they can foster their current research process at the moment they are doing. So this will definitely help in understanding the viruses and of course in terms of the drug discovery also that will be useful. So we already have this the heavy active role of AI in the healthcare area. Australians are talking about, if you talk about the Google, say, DeepMind's technology can detect over 50 eye diseases as accurately as a doctor, for example. And these are pretty old news, by the way, but these are the authentic. So I chose the selected material from the internet, so according to share with you guys. So then if you move to the next slide, which says, as I said, like so many applications, is like one is the robotic customer care, when support, which is more of a like thinking in like an approach in the connectivity with the hospital or healthcare facility provider through a chatbot or through a robotic call center, and of course disease prediction, data voice action, where you don't need to, because the hospital or you go to the ward and you go to the OT, in the clinic also, doctors are still using laptop, for example, computer or keyboard. But with voice action based technology over there, they can eliminate these screens and the keyboard, and then can just simply talk to the robot over there to access the patient's information, and like they can do more focus on the patient instead of like focusing the internet, the keyboard and the TV screen or the computer monitor over there. Now, of course, the diagnosis in imaging, that's one key area would be like using through MRI, through CT scan, through X-rays, you name it. So these are the model once trained on a good quality data, good quantity of data, can definitely exceed the diagnosis as of any specialized person in this regard. But these things are not to replace the doctors over there, the radiologists over there, none of these things, but are there to actually complement their efforts and to share their tasks over there. So again, the last line says the predictive analysis is a very key thing. Drug discovery, one important is the AlphaFold as mentioned, new treatment discovery also, and digital personal health assistant. So this would come through apps, smart apps thing, or maybe in the form of robots also. I think this is the profound application would be. So predicting, this is one example. So simple iris scan retina scan can detect so many things in terms of the, let's say when you say predicting cardiovascular risk, the AI can predict lots of kind of information or diseases or health related issues through a simple retina scan. So you can see the age, you can see the biological sex over here, smoking, what is the effect on the retina over there. We can see the BMI, we can have the blood pressure over there. So these are the indicators leading towards to identification of any kind of risk related to cardiovascular over there. Of course, these are the in terms of the robotic surgery. This is already now happening in a limited environment, but of course, this is the future. So, a doctor sitting here, a surgeon can perform an operation in a remote area or a remote site, perhaps with a precision at a sub-millimeter level over there. So, these are the, of course, the true benefits that will be coming. So now, in overall, we saw that yes, AI plus quantum computing plus robotics, and with the platform like or the protocols like blockchain. So we do see future coming ahead of us, which is like a very different from what we see today. And tomorrow will be a lot different. But now this AI come with lots of responsibilities. So we have to have code of ethics, code of conduct to be defined by the governments, by the state, globally by every country, and of course at a one platform, which is a global platform also. So in order to have a control in this technology, because if we don't do it today, we will not be able to manage the AI in the future when we talk about the AGI, which is artificial general intelligence. So we have to have a control, we have to have a code of conduct today to manage it. So of course, government should now think about a state policy in terms of the code of conduct, code of ethics, and especially also from the business's point of view, maybe it like hospital or any other organization, I would recommend and suggest that you have to be very careful while selecting AI solution, because today now everybody's talking about AI. So there are lots of fake AIs in the market also. So you have to differentiate from that. So what is the real AI? What is the fake AI? I'm not talking about the deep fake. That's a different application of AI. But here I mean people are selling AI, but it's not AI. So these are the things people have to the business, the management, the concerned people have to consider about very seriously. So in like within the organization also, like every organization has IT governance policy. So they have to go for a devise new policy for the AI governance also within the organization and of course at the state level. So these are the important things. And lastly, but not the least, of course, that's the education part. So we have to prepare resources for these AI, deep learning, machine learning, and of course, the quantum computing challenges, and of course, all those robotics. So we have to create an educational environment over there where we deliver quality education, and we need to prepare good quality resources accordingly so that we meet our future challenges in this regard. I think these are the key points I must say. Thank you. Thank you very much.
All right. Dr. Mansoor Saab is online with us.
Hear
Mansoor
me?
Saab, are you there?
Yeah, I'm here. Can you hear me?
Yes, we can hear you. Mansoor Saab, assalamu alaikum. How are you?
Walaikum salam. I'm fine. Thank you, sir.
It's always been pleasure and privilege to talking to you and having you on board actually.
Yeah. Thank you, sir. You're very nice of you. Any questions? I have to
I
answer.
have a small question. In fact, Mansoor bhai, you were talking in your presentation. You were talking about some disease protection and the prediction through AI. Can you just a
Yeah.
little bit elaborate what exactly how we gonna do that?
Of course, I mean that comes through the data. Data is the main source, of course, which we need to predict or forecast any kind of information, for example. So let's say we have data coming through social network, research data. We have data coming through the labs, and that that data can be fed to the system, and specialized algorithm, machine learning algorithms can be applied on that, and then we can predict a kind of a pandemic or a disease, like uprising, for example, in any given specific boundary, geographical boundary also. So the key thing is the data basically. So the data is coming from different sources, right? So we collect all the data, and then we combine all the data and we do apply the algorithms, and of course that will help us in predicting and forecasting.
All right. We were just talking about earlier. I hope you remember we were talking about something like our emergency data and
Yes,
for the ID
yes,
computerization. So
yes,
we are. I'm going to link your talk with that as that project as well.
absolutely, absolutely. And
Okay.
that is a very relevant thing, because that's the data. Already you have, mashallah, 13 years plus data when that is being standardized and is available. So we can do lots of forecasting and prediction, especially going, the Indus hospital is providing services to different communities, different geographical boundaries, for example, and that data is coming from all those regions. So we can isolate areas, and we can definitely help in like improving the lifestyle and the quality of life for those people over there through learning.
All right. Mansoor bhai, we have a question here from some of our participants actually. So what the question is, what is the current level of AI adoption in the healthcare sector of Pakistan and in which areas?
Yeah, I think Shtipai, this is at the moment, there's not too much I see at the moment. And secondly, the AIs, while you bring it into the healthcare sector, lots of responsibility comes to you also. So we cannot like go and simply adopt any algorithm and say, okay, this is now we are AI powered hospital or a medical facility over there. Those algorithms have to be like, uh, I mean, gone through several checks and parameters validation, and has to be also authorized by the authorities or the bodies. For example, in Pakistan, if we see we have. PM, I think the Pakistan Medical Association, PMDA also. These are, and there are several other bodies also. So those are the institutions and the government who, after the validation, only we can then think about like having these technology bringing in. But this is like that's just the beginning, and I'm sure in very in near future, lots of application will be seen in the healthcare area of AI very soon. And inshallah, in this hospital will, I think, will inshallah will take the lead in this regard.
Inshallah. Um, I really totally agree with your point of view, actually. That is why I actually, before starting your presentation, I talk about a show in 80s in which we were talking something on the technology side in the 1980s, and people were just laughing and thinking that this is not going to
True.
happen. The same thing is happening with the AI and artificial and
Absolutely.
the
Sir,
virtual reality. In these cases, we are
absolutely.
actually laughing that this is not going to happen, and inshallah, but the people
I
like
started my
you,
career. Yeah, I started my career in 1989, and that was purely in AI, artificial intelligence. So 89, 1991, I was doing AI-based projects and job and all those things. But you can imagine at that time when the internet was not available, also, I mean, in that sense. So, I mean, today is different. The algorithm, the machine, the hardware all changed. So it took long, and that people had no idea about AI. But uh, that helped me in a way that, like my cognitive approach, my philosophy, my logic building was totally being supported by those learning of AI. But today, of course, AI is everywhere. So we need to choose and pick the right kind of AI for the right kind of application, and of course, trusted one. And then future is there with the AI power, with the quantum computing machine, with the robotics, and the blockchain protocols and all those things. Future will be different altogether in terms of diagnosis of the diseases, prediction, drug discovery. In terms of like AlphaFold, if you say, and that's publicly available, Shakeel bhai, also. I think people should like get the advantage of AlphaFold publicly available models. Who the people who are involved in the drug discovery and disease related research. I think that is something, and which in few years of time, I see a radical change coming, inshallah.
Inshallah. And I'm sure, Mansoor bhai, people like you are devotedly and dedicatedly
Yes,
working
sir.
in the areas. I'm sure people will listen to you very shortly, and things will be moving on, inshallah.
Inshallah, sir.
Thank you very much, Mansoor bhai. Once
Thank you,
again,
sir.
I really appreciate your presence with us, and thank you very much.
Thank you, sir. Assalamu
Thank you very
alaikum.
much. Wa alaikum salam. Okay, ladies and gentlemen, we just learned a lot of things from the AI side, and of deep learning from Mansoor Bhai's presentation. And I'm sure there was no technical glitch at this time, so I'm sure you must have listened and seen this his experiences and his the talk about that the AI and all that. So let's move on to the next presentation, which is again it's my own presentation. So I'm going to take over as a speaker now, and I'm going to present my presentation. Can we have the presentation, please? Okay, we need to talk about the use of digital health at Indus Hospital Network. Actually, let me tell you something about myself first. My name is Shakeel Akhter. I'm working as a CIO in this hospital. I am basically a proud of being the first employee of Indus Hospital as well. In fact, in 2006, we started this journey, and we from the day one we were just talking about the paperless hospital management system because as a career, I am basically a software developer since 1987, but since 1996, I'm involved with the health information systems. And since then, I am working as a healthcare industry. So let me just get through my presentation. When you talk about IHN IT, then you need to understand what exactly the background of how this thing we're going to start. And well, I'll show you a small presentation in a digital format and the introduction of health informatics and something like that. Let me just go through with the presentation actually. Just give you a little brief about that. We started our journey in February 2006 when Indus Hospital took over the Islamic Mission Hospital and in a very raw format. And at the same time, we started our IT services. The first person was hired in a hospital that was the IT department. And that was a very tough time actually. We had no software developer available for the application, so that was the toughest area we have. July 2009, when the hospital construction was almost completed, we actually had a small in-house open house in this hospital in 2009. Let me tell you the story of the level of discouragement. You won't believe it. We had the first open house in 2009 somewhere, and more than 1,500 people were actually there to be with us. And we were talking about the paperless hospital and all that because people know about the Indus Hospital as a free of cost hospital, but they didn't know about that we are going to be a paperless hospital. So let me be very frank, 75% people who were actually visiting, they just said, you guys are fool. They were saying that you guys, that's not going to happen. So this was the level of discouragement we got from the first hand actually. But when in July 2010, this hospital was fully operational and functional. Uh, the entire hospital was paperless, and the all those two people who were just saying that this is not going to happen were not actually believing that we have started with the paperless hospital. And alhamdulillah rabbil alameen, it was just because of the grace of Allah and the effort of my team and the devoted people who were like Dr. Bari and Dr. Zafar Zaidi and so many other things, Dr. Asher. So they were actually spent day and night with the IT department, and we started this application. Before going into detail, I would like to give you a small video presentation on IHN Digital Health Services. Let me just go through with that. Idea of being paperless was actually conceived when we planned Indus Hospital to provide free of cost quality care to our patients.
When it comes to emergency care, retrieval of information is very important. You need to gather information all with a single click.
We have thousands of people that come in and walk through our doors daily. The fact that that data is compiled and ready to be extracted is enormous.
Medical experts and IT professionals work day and night to establish a sustainable as well as an effective paperless system.
For healthcare provision, one of the key ideas is evidence-based medicine. All physicians, all healthcare providers rely on evidence in order to practice best medicine. And so in that sense, our ability to capture data throughout the network really helps our doctors understand, and more so than our doctors, our operations understand the burden of disease and where we need to concentrate our limited resources.
We had a clear vision for our patients to get free from hassle of carrying papers, files, x-rays, and so many things, while provide best possible support to our doctors and clinicians with the help of electronic medical records.
Since my day one of joining, I really felt amazed because it was my first experience to be introduced into the world of electronic medical record system. Emergency environment is a chaotic environment. You got patient coming in. It's like bringing order out of chaos. And electronic medical record helps you in really bringing this order from that chaotic situation. You got patient coming in, then there is emergency process that is known as the throughput process. And then there is an output process alongside with that as well. So input, throughput, output, all plus together to form a complete, robust, efficient emergency care system. And electronic medical record helps you in dealing with that system.
And EHR give flexibility by providing opportunity to read the patient medical record in digital format. Besides extraction from the coded data, EHR can also provide the facility by extracting data from text mining. In short, EHR is the important facet to the healthcare industry.
Continuity of care play a vital role in emergency department where multidisciplinary teams are involved in a single patient care. For this, HMIS facilitate data retrieval, hence improved patient safety and efficiency. Meanwhile, the learning of nurses are identified through the EMR audit and the trainings are planned accordingly.
Indus Health Network is a huge set of hospitals and primary care centers, and the data that is produced is enormous. And the opportunity exists because we are a paperless hospital.
I personally feel with the electronic medical record system, you can achieve a lot. You can really map out your emergency department. You know what kind of patient that are coming to the emergency department. You can easily identify the things that have been associated with the worst outcome. You can remove those culprits from within your system. I personally feel more hospitals should adapt electronic medical record system.
Due to this paperless system, we not only save tons and tons of paper, which means saving millions of rupees every year, but also play a vital role in saving environment. This also helps Indus Hospital to achieve transparency in business processes and effective decision-making support to our management.
This in-house developed HMIS system allows me to monitor data from all facilities across Indus Health Network, irrespective of my geographic locations. This allows me to plan better and take all necessary action to rectify deviations in any of the data trends that I observe on HMIS system. It has definitely enabled us to perform efficiently while being more environmentally friendly by saving up on unnecessary data filing.
All right, we have just seen the videos where you have seen our paperless system working and the way we are doing it. So let me just share some of the details on it. This is like Dr. Bari just said, in-house build HMIS. It's covering above 60 modules implemented across IHN. I'm sure you must have aware that we are 14 hospital and one version HMIS is implemented throughout Pakistan, and this comprising all these modules, whatever we have in our system actually. So these are all in-house built modules, but we also have other modules, other products. For example, we have in-house developed HRMS module, but we also going with the Oracle Fusion application for our supply chain and financial accounting system. We are maintaining our customer relation management software with the Microsoft Dynamics and Siddharth Heather, and learning management with the this modal application. Are you sure presentation is working with that? Okay. So there are some of the very unique achievement which only Indus Hospital has achieved it so far. The first thing is basically we have a boat clinic which is running in Indus River from the Kutch areas to deeper areas of Indus River. Though we are actually running our live HMIS at our boat clinic. This is a very unique kind of achievement which Indus Hospital have. And the other thing is basically we got a bus clinics that we have got 4 buses running in Sindh and Punjab, and we are implementing our HMIS in those areas actually. Then we have 4 telemedicine sites, so the primary care sites, including the Bill Gilgate, the Saiwan, the Shadi Large, and Gurbani, where we are actually using the telemedicine, and in fact working for more than 200 primary care sites within 2 years, inshallah. So, and those all will be paperless, inshallah. We are using our satellite system to connect our telemedicine site from the Gilgit, Bong, and Badin sites. We are actually capturing medical record from the vital things, imaging and the investigation. We are using a lot of gadgets to save patient lives actually, and we have also engaged our patient through feedback kiosks. We have multiple feedback kiosks implemented throughout in this hospital, where patient can go and give us their feedback. Our QIPS department normally get the data from whatever the feedback they have given. They contact their patients and they get the actual feedback from them, and then these feedback kiosks actually move on to the middle management and finally to the dashboard of Dr. Bari. So he understands what exactly the patient feedbacks are. Technically it is direct from the patient to CEO of the hospital. We got a small portal for the investigation reporting. Currently, we are offering only COVID reporting. Other than that, we are actually working with the other investigation reporting as well. But right now, we are offering only the COVID reporting. We have an online self-screener for COVID patient as per WHO standard. When this COVID thing was started in 2 years back, we were almost the first hospital who launched their online self-screener. And more than, trust me or not, the more than 2 million people actually visited our website for their screening their COVID things. We are using this is a very unique kind of a thing which we are doing it right now. We have a video call tablet for our patient in isolation, ICUs, and COVID ward. When the patient is isolated or in the COVID ward, you cannot visit to them. So we have a tablet. Our tablet will you can as a attendant you can talk to your patients through a tablet twice or thrice a day very easily. So that's basically linking with your patient to your attendant. We got other facilities for our patient as well. We got a medical record printing through our EMR department, with some kind of forms are there. So prescription print just started with our outpatient, and we are using tremendous amount of SMSs for OPD and IPD patients. These are some of the patient engagement things, but we are also taking care our staff. When this COVID thing was started, actually, we had a problem with the hand touching with the attendance machine. So we started with our mobile app for a standard staff attendance. And Alhamdulillah, in the entire Indus hospital network, we are using our mobile app for the staff attendance actually. We got online and other applications available. We have online payslip, tax, and provident fund certificate registration generation is also provided to our staff. There are so many other things which are available through our network actually. We are providing enough secure network to our doctors and clinicians for their studies and research purposes. Throughout hospital, they can access internet from anywhere through their mobile or maybe from their laptop or something, whatever the device they have. We are actually providing information dashboard to our top and middle management. We got the number of dashboards, information dashboard to our management. From there, they can watch, they can monitor whatever happening in their in the hospital. For example, you can see this emergency and OPD and dialysis and the CEO dashboard in front of you. But there are other dashboards available also. Indus hospital is basically a free of cost hospital, and people think that we might be compromising in technologies. No, we are not. We are actually using state-of-the-art technologies, every kind of technology which is required for the maintenance of our hospital management system. We are working on that. We are using Oracle as a backend database. We have a Huawei network available. We are using, for security purposes, we are using the Fortinet and so many things. So we have not compromised anything. Our management is very concerned about the paperless management. So we are actually using the best of the technology available in Pakistan, and still we keep working on that. Our team is continuously researching and thinking about whatever the technology we can use to maintain our patients in this hospital network. Let me tell you something about our future plans as well. We are actually aggressively working with our HMIS version number 2 with so many things. Like we are currently the application we have that was not cloud ready, so we are actually working on the cloud ready solutions and the centralized database throughout IHN, because we got 14 hospitals, we got a number of primary care sites, we got number of blood disease centers and so many things. So we are actually working with the new version with the centralized database system throughout the network with this HMIS number 2. And we are using the web technologies like including the Angular and ASP.NET core systems. Our application, inshallah, will be a completely research-supported architecture. We are going for a modular approach with the mobile devices of friendly application, and inshallah will be with the enhanced user experiences. In fact, we are also working with the campus management system, which we need to be launched very shortly, because our university is going to be launched in 2023, hopefully, inshallah. And by the time, we'll definitely be able to provide our management with the campus management system as well. Other than that, we have a plan for extensive use of gadgets like IoTs, infotainment terminals, and Bluetooth-enabled trolleys and all that. We are working with the data warehousing and analytics. We are seriously thinking about that, to use the AI and on all those areas, which we just spoke to our presenters today. We are actually working with the implementation of international standards like HMIS and ISO 27001. We are upgrading our satellite-enabled networks for our outreach programs, including our primary care sites and the campus and the camp-based clinics. So this is basically, we are working at Indus Hospital for the betterment of our management, for the betterment of our management, and for the betterment of our patient care. So this is all from my side. Um, this is all from my side. I'm sure you must have got some idea of our digital network at Indus Hospital. Okay. All right, gentlemen, ladies and gentlemen, I hope I got some kind of a questions here. Um, is there any data bank which can be used by different organizations? Okay, this question is actually, these are two questions I have for the AI. I'll forward this question to Mansoor Saab, and I will get back to the originator of this question. If you have any other further question, please do so. Or maybe I have to go for my final remarks. All right. I think we should moving to our conclusion remarks, and I have a very simple conclusion of today's discussion. Actually, we have learned a lot of things from Dr. Zaki and Mansoor Bhai. They were talking about the past and the future technologies. I have a very simple conclusion. The hospitals which are not thinking, even now, they are not thinking about digitizing their medical record or their processes, they will be left behind. They should go live, they should go paperless, because what our patient is very smart. Nowadays patient, either they are health conscious or not, but they are very much coordinating with their healthcare providers with their gadgets on their hands. They have got watches, they got mobiles, they got so many things to capture their medical records. So if you are not going paperless, if you are not going for a digitizing your medical record, if you're not thinking about that, you will be left behind. I'm sure you need to think about that twice. Like we have said so many times in our presentation, that the coming world is basically of AI's world, virtual realities world. So without digitizing your medical record, without digitizing your processes, you will not be able to achieve the running world. Actually, you need to think about that. And I, as a CIO in this hospital, is here to offer you. If you have anything which we can help you. We can help you to understand your own needs. We can understand what software is gonna you can use it. We can understand, and we understand, and we can probably help you to let you understand what servers you can use, what network you should go with, what kind of internet you will be needing for that, what kind of applications you will probably be needing for your hospital, and how these medical record things are going to be computerized and digitized. We can tell you exactly. So we are here as in this hospital IT department to help you, and you are almost welcome for anything, any question, or either through this conference, or maybe later on. You got my contact numbers. You can contact me anytime, and we can talk about your needs. We can help you in understanding and determining your needs. So this is all from my side for today's session. It was very a pleasure. It was really good to have you on board, and it's always a pleasure to be talking about HMIS or healthcare, digitizing healthcare system. And I'm really grateful to the scientific team and the team here with me available for the entire this digitizing thing, the Orbit guys, and so many other people who spend day and nights to make sure this conference is going to work, inshallah. And we'll definitely be seeing you again in next icon. Thank you very much. Thank you very much. Assalamu alaikum. Pakistan Zindabad.